If you're taking a PPI, here are some things you might want to know. So if you don't know what a PPI is a proton pump inhibitor. It's a type of medication that prevents the stomach from producing hydrochloric acid. So why would we want to do that? So if you're suffering from reflux, when the stomach contents come back up into the esophagus, any hydrochloric acid can damage the esophagus and cause discomfort. That's where the heartburn comes from. But when you take a proton pump inhibitor, which includes things like omeprazole, lansoprazole, and many other medications that end in ZOLE, what they do is they block the production of stomach acid, and the idea being that that will enable you to get less damage to your esophagus. But they also help the digestive system to heal. They help the body produce something called mucin, which puts a protective layer against your esophagus and your digestive system. So oftentimes if you've been to the GP and you've got gastritis or you've got an ulcer, they'll provide this medication to reduce the damage that's done by the hydrochloric acid, but also to help the stomach to heal. And that's all well and good if you have got an ulcer or you've got gastritis. But if you take a proton pump inhibitor long term, it can impact your nutritional status and how much nutrients you can get into the body. So if we're not producing stomach acid, then it's much harder for our body to break down our food. If it's not breaking food down effectively, then it's harder for us to get that nutrition from our food. So we can find that we end up with nutritional deficiencies, and some nutrients are heavily affected more than others. So the two key nutrients that are affected by a proton pump inhibitor include magnesium and vitamin B12. Both of those play quite a key role in the body for producing energy, for brain function, for nerve function. And if you have a significant deficiency of either one, you can end up with pernicious anemia, you can end up with seizures, headaches, and the list goes quite on. The first sign actually is often fatigue. So if you're feeling tired all the time and you're taking a PPI medication, then it's a really good idea to ask your GP to test your levels. It's really easy to correct. If your levels are low, we can supplement those. The doctor can prescribe you some B12. He can also provide you some magnesium if you're clinically low. If you're getting headaches, you could take some magnesium to see if that helps. And that can really help to reverse that side effect. And that's really important if you're taking this medication because you've got an ulcer or you've got Barrett's esophagus, or you're taking medication which actually causes you to damage your digestive lining. So if you're taking things like ibuprofen or anti-inflammatories or medication to thin the blood, they can all damage the digestive system. And in those cases, the PPI does a really good job of protecting that stomach lining. So it's really important that if you've got any of those, that you do continue taking your medication. And what's really important is the time at which you take that medication. So when you take this medication, it needs to be able to access the proton pump. The proton pump is found inside the stomach, but it actually is hidden within the stomach until there's food present. So if you take your medication and then don't eat anything for 3 or 4 hours, it actually can't work because it doesn't get access to the proton pump and it can't do its job. So if that's what you're doing, if you're taking it in the morning and then only eating at lunchtime, it's actually not doing what it should. So my best piece of advice is to take your medication first thing in the morning, wait half an hour, and then have your breakfast. If you're taking a second dose later in the day, it's really important that you follow it with food 30 minutes later. So I see a lot of patients taking their proton pump inhibitor and then going straight to bed. In that case, it isn't going to work. You're not getting the best out of it. So a better approach is to actually take it before your evening meal so that the food that you eat as part of your evening meal can help to make that work. So that can be really, really important and something that you really need to be aware of. So if you're just taking a proton pump inhibitor and you've just got simple heartburn, if you're maybe buying it over the counter from pharmacies, supermarkets, what you need to be aware of is that it isn't the only way to support your digestive system. and long-term use of a proton pump inhibitor can impact that nutritional status and can also give you quite a few digestive symptoms. So if you're in that bracket where it's not essential for you, you've not got an underlying condition, then you might also want to think about other ways in which you can support your digestion so that you're not finding that you're having to take this medication all the time. Now, the issue with stopping a PPI is that once you've taken it for 3 days or more, the body creates something called rebound acid hypersecretion. So essentially what happens is while you've been taking this medication, the body hasn't understood why the signals to produce stomach acid haven't worked. And what it does is it upregulates the production of those signals to try and overcome the problem. So the more you take a PPI, the more cells that stimulate hydrochloric acid are produced, the more chemicals those cells release, and the bigger the signal to produce acid becomes. Whilst you're taking the medication, that has no impact because the body can't make the acid because the proton pump has damaged. The proton pump inhibitor has damaged the proton pump. So when you stop taking the medication, there's loads and loads of signals waiting to tell the stomach to make acid. And it's almost like having water building up behind a dam, the dam bursting and the water flooding through. So what a lot of patients find is that when they stop taking their PPI, they get acid reflux that's maybe 3 to 5 times more severe than what they had to start with. And that usually means that they end up remaining on their medication unnecessarily because they don't realize that this is just part of the process. So it's really important that if you have been taking a PPI long term and you're wanting to come off it, that you work with your GP, work with one of my practitioners, for example, who can help you with that process so that you manage that rebound. Because the last thing we need is for that acidity that comes to damage your esophagus and cause you problems longer term. I'm going to be speaking about this a lot more in future videos. So if you are interested, if you do suffer from acid reflux, then please do make sure you like, share, and subscribe to my channel, and keep an eye out for future videos that will be going into this subject a little bit more, and we'll talk about how you can manage your reflux more naturally without relying on PPIs.